We have to give the patient what they need. But I like very much this technology. It's easy, it's fast, it's more reliable for us, and another, and very important, it's safer for our patients. When we go to a patient to the surgery and place implants or a bone graft or whatever we want, we already have all the things in our hands to be successful or for be more successful. This patient with that kind of bone have the opportunity to have fixed prosthesis. A very safe way, in a very accurate way. And another thing, remember what the patients are asking us. Please, the best technology, fast, with function and aesthetics. That are asking in our clinics, Tuesday, Wednesday, when you go back to your office, to your clinic, some patient is going to ask that. In conclusion, what they want: time, aesthetic, function, and quality. In conclusion, that's what the patients want. What they're talking in our language is loading, speaking, and smiling. I just arrived last night. I had the opportunity today about hearing 3 lectures. They were talking about beauty. They were talking about function. Okay, the patients want that. They really want that. But now they want. It's very extensive. We have to define the different immediate loadings we have. One is immediate occlusal loading. This is full loading. We have immediate non-occlusal loading. This is for smiling. Okay. Immediate non-occlusal loading and early loading. And final, immediate occlusal loading with provisionals. We have a wonderful, we see a wonderful case just 20 minutes ago. Provisional prosthesis, this new technique that we are using, a lot of doctors, 06, 04, whatever you want to say the name. Why is immediate occlusal loading? Professor Adriano Piatelli from Italy explained us and told us, if you're going to place a full loading crown or bridge, it has to be before 6 hours. Because if you don't place it in that time, the bone is going to change, and we're going to see how it's going to change. There are some things that we have to remember before. Micro movement of the abutment. Micro lesion. Dr. Paul Way explained us wonderful this in our meeting in Miami. The study presented from Hamburg in Germany University. The micro movement of the abutment. Even with internal connection. If you want to place internal connection in the implant, you have to have a space. That space, for small it is, it's a space and it can move. And only with 50 newtons, this is the movement it presents. We see this with external connection. We know about this, but now he's playing us. They notice in these images, in these photographs, you see where the collagen fiber goes to the lower part of the blade, not of the top, of below. So the design of the blades is very important. And another thing, mineralization, faster than unloading. This is what we've been using the last 30 years of our practice. And look what happens when we load an implant in immediate loading. Full charge. 1 to B. And these days, in Dent Street, really trying to give all the things that the patient is asking, you better have in your right hand digital solutions. Really not for all the cases, but the majority of the cases in your clinic, you're going to need it. But because if not, the doctor next door, maybe he will have it. And you can see the patient go to this next door. That's what's happening in Korea. We don't see that in Mexico. Not yet in the States. But in Korea, you see that. What's it going to be in the future in the United States and Mexico? Maybe the same.